Dr. William Davis here, author of the Wheat Belly and Undoctored books. These are 7 things you should know before you ever see or talk to a doctor. Now, I'm a doctor also, but I made it my business the last many years to understand health, not the healthcare system. That is what MRI device to send you to, what neurologist to consult, what procedure to do on you, what prescription drug to hand you. No. Understand health. But you'll find that doctors are the worst at health. So these are 7 things you should know before you put too much trust in any doctor. First of all, like I've suggested, doctors are absolute amateurs in health. I'm generalizing, of course. There are very excellent functional medicine practitioners, integrative health practitioners, naturopaths, etc. People who do make it their business to understand health. But the average mainstream doctor knows virtually nothing about nutrition or nutritional supplements. They might have gotten their information, for instance, from a magazine or from TV. They're not reading the scientific papers on nutrition. They're not reading the scientific evidence for this or that nutritional supplement. So it's crazy that we're often told, talk to your doctor whether this supplement is appropriate. He's not going to know. He or she's not going to know. They have no idea. That leads to number 2. Doctors are very good, and do this very often, they're very good at delivering ignorance with complete authority. No, don't take that fish oil, it's stupid, it'll make you bleed. They say outrageously silly things like that, not because they're concerned for your safety, not because they have a deep understanding of the science, but because what they're saying is, I can't be bothered really understanding all these nutritional supplements or nutrition, so just stop it. And maybe I'll even belittle you because you want to do that. That's how they work. The majority of them work. So don't take that kind of advice. Find out for yourself. And don't ask your doctor if this supplement or that supplement's appropriate, because he won't know. 3, if a doctor says something like this to you, oh, did you consult Dr. Google? Or some kind of wisecrack like that, walk out. You're not going to get an advocate for health with answers like that, right? This is a person who wants to make fun of the fact that you're interested in your own health. They won't give you solid answers. They will give you tainted answers, that is, answers that are suited to their needs, to the healthcare system's ambitions, not to your needs. 4, you should know that the majority of doctors nowadays are heavily incentivized to churn you for revenues. In other words, the doctor is often told, doctor, at the end of this quarter, the more revenue you generate for the system, the larger your end of quarter bonus will be. So the doctor's incentivized to order more MRIs, CAT scans, lumbar taps, neurology consultations, all those kinds of very high-ticket items, because his bonus will balloon. Maybe it would have been nothing, now it's $50,000, $75,000, very big. So there's huge incentives to churn their patients through the system to generate richer revenues. 5, never take advice at face value. It could be in the form of a prescription, it could be advice to have a procedure or see another doctor. Ask why, and what are the alternatives, and what are the issues with this? So if it's a drug, for instance, a drug prescription, ask why, what are the side effects, what are the alternatives, are there natural ways? If you don't get solid answers, don't do it, right? I would even say don't even pay the bill. But make it clear the doctor did not do his job. If your car wasn't starting, and you took it to the mechanic, got towed to the mechanic, and he calls you 5 days later and says, I still can't get it started, $500 please. You wouldn't pay the mechanic, right? If the doctor doesn't do his job, why would you pay the bill? If he doesn't answer your questions, doesn't provide you the services you came to obtain, I would object and make a big fuss about not paying the bill. 6, despite all that, resist the temptation to educate the doctor because 1, most are not educable because they don't want to be educated in health. They want to be educated what prescription drugs to hand out, what procedures to do, what tests to order, but not health. So if you provide a book or magazine articles or journal reprints about some study, it's highly unlikely that will ever see the light of day. It'll be tossed into the garbage. I've seen it happen so many times. So don't even try. And it's not your job to educate the doctor. If the doctor is not educated about health, don't go to that doctor. You can't undo 10, 20, 30 years of bad learning, right? Of listening to drug representatives, of ordering tests, and not paying attention to health. You can't undo that with a couple of papers or a book. So don't even try. Find a better doctor. And then lastly, 7, when you have any kind of testing, whether it's laboratory testing or whether it's some kind of a procedure like an echocardiogram or an EKG, get copies of the results. The information is your property. The actual test results are the hospital, the doctor's, clinic's property, but copies, the information is your property by federal law. If they say, oh no, that's the doctor's property, you can't have that, wrong. By federal law, it is your information. The actual copies, that's theirs, but the information is yours to obtain on request, okay? They cannot turn you down. If they refuse, report them to the medical society because they must provide you the information upon your request. So the doctor's office, the hospital, these are very dangerous places because they don't always, sometimes you have good doctors who do put your welfare first, but too often in the modern medical system, revenue and profit is put ahead of your health. So understand that. It sounds cynical, but you know what? It empowers you because now you know you're the one in charge of your own health. You should seek out the information. You should collect information. You should collaborate with other people, right? So that's what you're doing right now, right? Getting better information. So just be very careful whenever you come in contact with the healthcare system. Understand that you are going to be the arbiter of what you do and what you don't do.